So as a result, we have a situation in Iraq. I'm going to just talk about Fallujah in particular. This is a city that in November 2004 bore the brunt of a massive U.S. siege on the heels of a siege in April of that same year, where the U.S. basically bombed and shelled the city into submission and then took control over it. And recent studies show us that in Fallujah, that we're seeing as many as 25% of newborn infants in that city with serious physical abnormalities. Some of you, I would presume, have probably seen photos of babies born when their parents have been exposed to DU. It's horrific. I'll leave it at that. Cancer rates, correspondingly with Fallujah, in Babel, which is an area near Babylon just south of Baghdad, have risen from 500 cases in 2004 to more than 9,000 in 2009. If we move down to Basra, city in South Iraq that was hit heavily during '91, as well as the more recent invasion, there at the oncology center, we have Dr. Jawad Al-Ali, the director of that center. He told Al Jazeera English that in 2005, there were 1,885 cases of cancer that he treated at the oncology center there. That number increased to 2,302 in 2006, and in 2007 to 3,071. So that means from 2005 to 2007, it almost doubled in the number of cancer cases that center saw. And then he added that now, more recently, we're going from basically 3,000 cases in 2007, that now every month, he told Al Jazeera English recently, his center is seeing between 1,250 and 1,500 patients every month. Then we have Dr. Ahmad Hardan, who served as a special scientific advisor to the World Health Organization, the UN, and the Iraqi Ministry of Health. He said there's scientific evidence, of course, linking DU to cancer and birth defects, and doctors like Abdul Haq Al-Ani, author of Uranium in Iraq, say cancer cases increased dramatically after both the 1991 war and the 2003 invasion. And then when we move over to, and I should just add before I leave the Iraqi perspective, that in my now 9 months reporting from Iraq, it's impossible to go around Baghdad and talk with people and bring this up, and either they have cancer or a family member or a close friend or a relative. Everyone knows somebody that has some kind of cancer in Iraq. It's a pretty amazing thing to witness. And then correspondingly, the soldiers firing the DU munitions, for example, I've interviewed soldiers, some of them in this more recent book, who rode around in M1 Abrams tanks. Those are the big giant tanks. And some of these tanks, the hull, the bottom part, is actually DU, so that if they go over a bomb, that will protect them from the bomb. Of course, they're sitting, and Helen Caldecott has spoken of this as well. They're sitting, ergo their testicles, right on DU. So you can imagine the effects this has. And we are seeing the effects that this has. Babies born to U.S. veterans from the 1991 war were showing birth defects very similar to those with Iraqi babies. And many U.S. soldiers now returning from the current occupation of Iraq are referring to a Gulf War syndrome too. We know of the Gulf War syndrome in the wake of the 1991 war. And the current soldiers who are making these allegations are saying that they have developed cancer directly because of exposure to depleted uranium in Iraq. Furthermore, we have Dr. Doug Rockey, who is the former director of the U.S. Army's DU project during the first Gulf War. This was the guy who was in charge of a project of decontaminating American tanks from that war. He told Al Jazeera English that it took the U.S. Department of Defense, quote, in a multi-million-dollar facility with trained physicists and engineers, 3 years to decontaminate the 24 tanks that I sent back to the U.S. What can the average Iraqi do with thousands and thousands of trash and destroyed vehicles spread across the desert and other areas? And this story has largely been basically ignored by most of the corporate media. There's been a few odd Associated Press stories about it, and then other more alternative journals like the Washington Report on Middle East Affairs or the Public Record. Surprisingly, there was one good story on it in Vanity Fair in February '05. But aside from a few exceptions like this, it's been largely ignored. And yet cancer rates are skyrocketing off the charts in Iraq. More and more veterans are coming home with mysterious ailments, and their wives get pregnant and have children that are continuing to have birth defects as well. So this is a critical story. It's clearly not going to go away. And the physical effects of this are just really staggering. And again, this is something that I'm really grateful that PSR takes on this issue. And there's people around the country in PSR that are working on it as we speak for solutions, as well as, at this point, what I think is paramount, awareness to the general public that this is happening. On that note, a last thing I want to talk about regarding the health effects of war that really never gets discussed, and I am certainly no expert on the topic that I'm going to bring up, but I think all of us have to think about how are we all spiritually affected by the policies of the U.S. government. Most of us are all too aware of a policy of empire bent on global domination. My research has had me reading government documents that define U.S. foreign policy, like the National Security Strategy, the Quadrennial Defense Review Report, many, many other documents that you read these. It's impossible not to see basically a blueprint for world empire, global domination, taking control of countries that have natural resources that our government wants, taking control of areas where those resources will be shipped, and looking at what this is all about. So what is the spiritual cost for us that this continues to be done in our name and with our tax dollars? And I think, like DU, this is another hidden cost of these wars that we all have to think about. What does it cost us? We live in this country. We understand what's going on, whether we talk about it or not. And, what does this do to us individually? And, it's something that I think we all have to deal with. We're all complicit. If we live in this country, we pay taxes. We avail ourselves of what's happening in this country, what's available. We are all complicit to one degree or another, and that is something that I feel like we all have to think about and kind of sit with and meditate on personally. What is this costing me? And then more importantly, what can I do about it, and what should I do about this situation? And, I don't try to end my talks with, blowing smoke or trying to kind of candy coat what I think is a massive crisis that we're living in right now that's likely to get much worse before it gets any better. But at the same time, again, I think that when we all get involved and we do things like become more active in PSR and we take up our respective causes, and then we see younger folks like the 3 essay winners here with us today, and the well over 150 people that entered essays this year that, as I understand, was a huge, I think at least a doubling of the number of essays that had been entered previously. It certainly gives me hope. And there was an activist, I don't remember his name off the top of my head, but someone asked this guy. He was always going to demonstrations, even if he was one of 3 people, and he would go do sit-ins, even if he was the only person. And they asked him, why do you keep doing this stuff? You're not, this system's so big, you're just one guy, or there's 3 of you out here, or maybe 20 on a good day. Why do you keep doing this stuff? You're not going to change them. And he said, I may not change them, but I'm doing this so that they sure as hell aren't going to change me. Thanks, everybody.